And we continue our series on the new normal, looking at how the pandemic is dramatically changing our everyday lives. Up now, visits to medical offices. Dental offices are reopening after months of handling only emergencies, but now all 50 states will allow routine dental care. But dentistry is considered one of the highest risk professions for the coronavirus. Our senior medical correspondent, Dr. Narula, shows us the unique challenges.
Someone asked me in January, hey, you ever think about taking 3 months off from dentistry? And I'll be like, yeah, when I retire. It was never on my radar that we would have to shut down for this long.
Dr. Peter Schatz is chairman of the Georgia Dental Association's COVID-19 Innovation Task Force. He's one of the people trying to help dentists navigate complicated guidance from the state, OSHA, and CDC on how to reopen safely.
We were stood up to help our members better understand the complexities of the coronavirus, from science, research, availability of PPE.
90% of dental offices in the U.S. were open for elective care by the first week of June, but it won't be business as usual.
So the traditional waiting for your doctor's appointment inside the reception area is gone. We send a team member out into the parking lot actually to shoot a temperature, make sure that they're not experiencing any illness.
What makes dentistry so high risk isn't just proximity to patients' mouths. It's the nature of the procedures themselves.
What are some of the things that generate the most aerosolization of the virus?
Anything using a high-speed handpiece, so fillings, doing root canals.
Dr. Kirk Norbo co-chaired a COVID task force for the American Dental Association.
We're hand scaling now the teeth rather than using the Cavitron or the ultrasonic scaler to create as safe as an environment as we can.
The CDC recently updated its guidelines to address routine dental care, stressing the importance of PPE, allowing downtime between patients, and prioritizing emergency care. But a number of hygienists CBS News spoke with feel it's still too soon.
I'm telling all of my friends and family, do not go to the dentist. It's probably the worst, most dangerous place you can go right now just because of the nature of the work with the aerosols.
Now let's take a look.
Dr. Schatz and Norbo disagree and worry delaying care could lead to other health issues.
The biggest risk in dentistry is uncontrolled infections, and those could lead to systemic disease, can aggravate underlying heart problems.
I think a lot of people at home are going to be wondering, is it safe to go to the dentist?
I think absolutely it's safe. The biggest thing I'd say is we're here for you. We're back in business. We feel like we've got a safe environment for our patients to return to.
And Dr. Narula joins us now for a broader look at the safety of any and all visits to the doctor right now. And good morning, doctor. That's an incredible piece at look at what dental officers are doing. But looking more broadly, what should any medical office be doing to welcome patients safely?
Well, Tony, there's a lot that offices can do to not only make patients feel safe, but also to actually protect them. The first thing really starts with screening patients on the phone. So having a nurse or nurse practitioner call and ask about fever or any symptoms, and that might triage them in a different direction. Then when they show up to the office, really separating anybody who's sick from the well, quickly putting someone with any sort of respiratory or fever symptoms into their own room and keeping that one room for sick patients and the rest of the room for healthier ones. In addition, the waiting room that we're used to is going to look very different. So chairs will be placed 6 feet apart. As you saw in the package, many patients may be asked to wait in their car until they get a text message. Any toys or magazines or flyers will really be removed from waiting rooms. You'll see lots of plexiglass barriers, lots of sanitizer, tissues, waste baskets. And then we are not going to probably be allowing non-essential visitors with patients. So those days where you brought your whole family with you into the room, it's really going to be limited to just the patient.
Yeah, so as patients, we should be asking questions about whether these things are in place. But another question we'll be asking ourselves is, how do we prioritize different visits we may have? What goes first, what's second, what third?
That's a great question. And the first thing to do is really talk to your doctor and figure out, what kind of a patient are you? Do you have any chronic medical conditions, any urgent symptoms? Do you need any vaccinations or any important screening tests that might say you should come in now and not put it off? On the other hand, If you're someone who's healthy and it's a routine checkup, you may be able to wait. You should certainly ask the office about what their protocol is, and that good communication is really important. And importantly, you should ask about telehealth. Telemedicine is really something that's taken off. We've been using it a lot, and I have to say I've been pleasantly surprised by how well and how efficient it is. And patients really like that visual one-on-one encounter.
Yeah, I had a telehealth appointment for baby Teddy just a couple weeks ago, and it worked perfectly. So, Dr. Narula, thank you very much for the telehealth endorsement. It can work, and the broader recommendations are wonderful as well.